Yeah. She's a doctor. How do we address you, your designation?
I'm an endocrinologist.
Okay, she's an endocrinologist.
Where am I looking at?
Glad to have you back. Now, it's World Diabetes Day and endocrinologists are calling on the Nigerian government to exempt import tariff on insulin and other drugs for the management of the diabetes. But they say it will allow more patients to have access to affordable care for the chronic disease. Vivian Irikefe has more.
For more than 20 years, Sam has been taking insulin medication. It's a hormone that regulates blood sugar. Sam will depend on the insulin for the rest of his life because he is diabetic. Sadly, not everyone who needs the treatment can afford it.
When the frequent urination started, I just walked to the doctor's clinic and they checked and they said, yeah, I was diabetic, and since then I've been controlling it. I'm actually on insulin and some other oral medication. The main challenge for Nigerians living with diabetes is the fact that they cannot control the condition because the drugs are expensive and the test kits, you have to, for you to be able to control diabetes, you should check your blood sugar on a daily basis. Many cannot do that because the strips are quite expensive.
The cost is quite enormous. Most patients in Nigeria pay out of pocket because we don't have strong health insurance. And how do you expect the economy to grow if the population that are meant to grow the economy are down with this disease?
Restrictive diet has always been an issue in the management of diabetes, but this endocrinologist says it's irrelevant.
There is no special food for diabetic patients. The diabetic patient is managed with the food that is present locally and culturally acceptable to the patient. What is important is the quantity of what the patient takes, not the food itself. It is not caused by the food you eat. It is the problem with insulin and insulin not working well.
The chronic disease is more troubling for women of reproductive age, especially where there is lack of affordable access to care.
A lot of women out there have diabetes they don't even know, and most of them are pregnant and they have diabetes and they don't have access to care. And what do you want at the end of a pregnancy? You want a live mother and a live baby, and that is why attention is on them so that we can actually look out for these people and make sure that they have access to care so that they can be healthy.
Adults with diabetes are predisposed to heart attack and stroke. The signs and symptoms include frequent urination, unexpected weight loss, and poor vision. Vivian Irikefe, TVC News.
Well, this year's theme is Women and Diabetes. There are currently more than 199 million women living with the disease, and this total is projected to increase to 330 million by 2040. Consultant endocrinologist Dr. Afoke Siawe is in the studio with me to talk more on this. Thank you for joining us at this time. We understand that women in reproductive age are more at risk of contracting diabetes. Why is that?
First of all, the placenta hormone, the hormones produced by the placenta lead to insulin resistance. And so you have a number of women coming down with what we call gestational diabetes, which is diabetes that is first of all diagnosed during pregnancy. And as you can see, the theme for this year's World Diabetes activity is Women and Diabetes, Our Right to a Healthy Future. Statistics show that majority of the women with diabetes in pregnancy are under 30 years old. And we are advocating screening, having access to screening for gestational diabetes, having access to screening for women who are at risk, and then preventing the complications from coming in. And you know, when you target the women, once they are empowered and educated, you are protecting the future generation. They take care of the children. You have a healthy pregnancy outcome, and then they're able to take care of the family better. They teach the children, and things are improving.
Then how easy is it for women to have easy access to healthcare, especially those battling diabetes?
That's the problem. It's not so easy. Like Onomere said during her documentary, the cost of the medications are expensive. And even before we get to medication, how many women who are pregnant and who have diabetes are being detected? Many hospitals are still not screening pregnant women for diabetes. This shouldn't be the case. Screening should be affordable and accessible to every pregnant woman living with diabetes. And even for the women who already have diabetes and are planning to get pregnant, there should be some form of preconception counseling and planning so that the pregnancy outcome is better.
So what should be the focus now, and from which institution? From the government, an action plan from the government, or from medical practitioners to spread the awareness, and then like you said, ensure that those pregnant women are screened during their gestation period? It's
teamwork, which starts from the primary care level. It's not only the government, but the government and the public sector, private-public partnership. So advocating screening from the primary care level to pick up women with diabetes early. And not just screening, putting enabling environments to make sure the risks are reduced and fewer women come down with diabetes.
But is it even preventable?
Oh yes, up to 70% of the cases of type 2 diabetes are preventable with lifestyle, healthy lifestyle, weight control, exercise, preventable.
But is it curable?
For now, diabetes is not curable for now.
So that brings me to the question of patients having to live by using insulin, which of course I understand, according to the report of our correspondent there, that is quite expensive and even scarce in the first place in the country.
Yeah, we don't produce a lot of things in here. So one of the problems is we don't produce insulin in Nigeria. We import everything that comes in. So by the time you factor in import duties, storage, insulin has to be stored in a cold environment, the cost of insulin goes up. And for the pregnant women with diabetes, right now it's insulin we give to pregnant women with diabetes.
But so then they are resistant to it because of
there's insulin resistance, but that is what is used to treat the pregnant women with diabetes because it's the safest medication for the unborn child and all that. So it's not readily available in the sense that it is expensive. And most people pay out of pocket because the health insurance sector today, the way it is, covers less than 5% of the Nigerian population. So you can imagine the individual bearing everything out of pocket. So if, from the government point of view, if they can cut off all these import duties and all these taxations on the products, it will reduce the cost of insulin by the time it's getting to the common man on the streets.
In that report as well, an endocrinologist said that it's not about what a patient eats, it's about the insulin not working right.
Okay, let me just, there are two types of, there are three main types of diabetes. You have the type 1 diabetes in which the body doesn't produce insulin at all, and those individuals are dependent on insulin. They need insulin to survive. And then you have type 2 diabetes in which the body does produce insulin, but there's some form of resistance to the body's working of insulin. And then you have gestational diabetes, which is diabetes that is first diagnosed during pregnancy. So in all, you need insulin at various stages of care for the three groups of persons living with diabetes.
And as the world is commemorating the day, what should be the focus generally?
The focus should be preventing diabetes, especially type 2 diabetes. Most of the people with diabetes in Nigeria and worldwide have type 2 diabetes. The key is prevention. It's alarming that we're having children coming down with type 2 diabetes today, and it's all because of our lifestyle. People don't exercise, people are gaining weight, and people have a family history of diabetes and people are coming down. And you see people getting blind and having amputations and all that. So prevention is the key. Exercise regularly, eat healthy, and keep a healthy weight.
Mm-hmm. And the symptoms again, could you tell
The
us
main
something?
symptoms, frequent urination, weight loss, excessive thirst. But having said that, over half of the people with diabetes do not have symptoms. Yeah, they picked up when they go for cataract surgery or they have a sore that doesn't heal. And that's why during this period we advocate screening, especially if you're at risk for type 2 diabetes. If you have a family history, your father, your mother, your brother, your sister, a grandparent, or if you're over 40 years old, or if you're overweight, you should be screening for diabetes regularly.
All right, thank you very much for the analysis and, of course, the need for people to take their health seriously. Dr. Afoke Siawe, you're an endocrinologist. Thank you for coming to the studio.
Thank you for having me.
All right, still to come on TV's News Hour. A day of mourning for victims of the powerful earthquake in Iran. Plus, Nigeria's customs makes fresh plans to check expected increase in smuggling on waterways as Christmas nears. We have details of those stories and more in a moment. Stay with us. Glad to have you back. Governor Akinwumi Ambode of Lagos has challenged Folashade Adesoye to hit the ground running and work to bring out the best in the civil service as she becomes the state's 20th head of service. At the swearing-in ceremony, Governor Ambode said concerted efforts have been made to place the state civil service on a sound footing. He challenged the new head of service to use her office to galvanize civil servants in order to build on the gains already recorded.
As the head of service, all eyes are on you to provide leadership and direction to the over 100,000 civil public servants in this state. You hold a strategic position to bring out the best in everyone, from the body of permanent secretaries down the ladder to the junior staff. And there is more to be done in areas of quality service delivery to the public. The success of your tenure will be assessed not by the efforts you are able to put in, but a tangible outcome in terms of improvements in the outlook and deliverables of the entire workforce.
In her response, Adesoye thanked Governor Ambode for the opportunity to serve, assuring that the public service under her watch would redouble efforts in ensuring speedy, efficient and effective implementation of government policies and initiatives.
I pledge my unalloyed loyalty to His Excellency Mr. Akinwumi Ambode, the Governor of Lagos State. In addition, I reiterate my total commitment to the duties and responsibilities of the office of the head of service and promise to do all that is within my capacity to justify His Excellency's trust and confidence in me.
The member of the Lagos State House of Assembly representing Koshofe 2, Tunde Brahimo, says the local government administration in the state is second to none. He was speaking at an event to mark 100 days in office of the executive chairman of Ikosi Sherry. Brahimo commended the chairman of the local council development area for his commitment to building the lives and capacity of Ikosi residents. The chairman, on his part, explained that his works are all aimed at improving the economic values of the LCDA.
Well, my assessment of the local administration in Lagos State, especially